Counting Down 60 Minutes with Dr. Tajuddin Agbara. He's a lecturer in infectious diseases at the Midwestern University, Illinois in the United States, and a board-certified infectious disease specialist licensed to practice in the states of Illinois and Indiana.
Viruses are not bacteria. They are intracellular. They manufactured themselves inside a living cell. They don't live outside the cell. They make up of themselves inside a living cell. Because of that, it's not easy for us to have a cure for viruses in general. But they can be suppressed from growing. The Ebola virus, there is no approved medication yet for it. The reason why there have been scattered outbreak. It has not caused major epidemic like we've seen with flu. In 1918, we saw flu that killed millions of people.
Yes.
The Ebola virus scattered, I believe the last outbreak was in 2000,
yes,
where we have about 450 people. The manufacturing company have not embarked on medication,
yes,
that can be useful. There's a CMAP, the medicine they have, but they haven't made enough because number one, the medication is being used only in animals, chimpanzee, monkeys, and the conclusive studies have not come out. So they said it may be effective in them. So experimental in humans now, we have it experimental in humans. We don't know much about the side effect of the medicine yet. We know it's like a monoclonal antibody. That's what we know about the drug. It's the CMAP. It's supposed to attack. It attaches to the cell in the body, and so the virus does not multiply more. What it does, it attaches to the cell. It doesn't allow the virus to multiply more. There has not been enough studies in humans yet for us to say conclusively this is the medication that will work or cure the virus, and it's experimental at this point. We don't know if it's going to be as effective. We know there are 2 people in America that are taking the drug now, that through American are taking the drug that they say is working for them. But the only thing I'm not sure at what stage did they receive this medicine? Did they get medicine in the first stage when they have flu-like illness, or in the third stage when they have the so-called bleeding diathesis, so-called hemorrhagic syndrome, which is the third stage? We don't know yet. So until we have enough documentation, we have enough proof, my belief is this medicine is still experimental, and it should be offered to anybody who seeks the medicine, but it's experimental, and that's
and they should be aware that it's an experimental drug.
That's correct. It's not a cure.
Yes.
And we don't know the outcome, but in humans yet. Even in animals, they did the studies. The studies are not enough for us to say conclusively this is a cure.